A very good day. This session we are going to discuss about adrenergic neurotransmission. So let's consider an example of synapse. So this is the presynaptic neuron and this is postsynaptic connection, and in between is synaptic cleft, which is a hollow space where these neurotransmitters are released. Now catecholamines are synthesized from amino acid called as tyrosine. This tyrosine works on by tyrosine hydroxylase, which converts tyrosine to L-dopa. Then this L-dopa is converted to dopamine with the help of another enzyme called as dopa decarboxylase. Dopa decarboxylase is available at both the sites, that is in the periphery as well as in the brain. Then this dopamine then enters the vesicles, and that's where it can be further acted upon by dopamine beta hydroxylase, which converts that into norepinephrine. And once this norepinephrine is formed, it is stored in these vesicles. So vesicles are nothing but these are the balloon-shaped structures which stores these neurotransmitters. And when the nerve impulse takes place, these vesicles, they are released into the synaptic cleft. Now there's one particular drug which can inhibit entry of dopamine into the vesicles, and thereby it would deplete the neurotransmitters in these vesicles. And when the vesicles, it depletes these neurotransmitters, these drugs are generally called as depleters. A classical example of depleter is reserpine. Reserpine is known to reduce blood pressure by decreasing the neurotransmitter, that is norepinephrine, at the various sites. But the major problem with reserpine is, as it reduces the amine levels in the brain, it can cause depression. And that's the reason why it is not used commonly. And even there are incidences of suicidal tendencies associated with this drug. So reserpine, remember, it blocks vesicular amine transporter, that is VAMT2 transporter, uptakes of the amines. And whenever there's a impulse conduction, these neurotransmitters are released, and these are released into the synaptic cleft. Now there are drugs which can inhibit the release of norepinephrine from various sites, and these drugs, the examples are bretylium, gonadrel, gonethidine. And these drugs basically inhibit the release of these neurotransmitters in the synaptic cleft, and thereby it reduces the sympathetic function in the body. Now there are drugs which can increase the release of these neurotransmitters from the vesicles. So it's like they squeeze the vesicles to release a lot of neurotransmitters. And the term which I would like to give for these drugs are releasers. And basically the releasers increase the release of neurotransmitters. Classical examples are tyramine, ephedrine, amphetamine like drugs. Now these drugs, they increase the release of neurotransmitter, and hence they are called as indirectly acting sympathomimetic agents, because their action is indirect. By increasing the release of norepinephrine, it is increasing the action of sympathetic system. Now once the neurotransmitter is released into the synaptic cleft, it goes and binds to the receptor, and once it binds to the receptor, it should give the effect. Say for example, when norepinephrine binds to beta-1 receptors in the heart, it would cause increased force of contraction, increase in heart rate, and increase in conduction. The drugs which stimulate these sympathetic receptors or adrenergic receptors are called as adrenergic agonist. And there's a long list of adrenergic agonists, which includes adrenaline, or also called as epinephrine. So epinephrine and adrenaline have, they mainly stimulates alpha 1 receptor, alpha 2 receptor, beta 1, beta 2. So usually they stimulate all the receptors of the sympathetic system. Noradrenaline or norepinephrine will stimulate all the receptors except beta 2. So that's what your understanding should be. Except for beta 2, it does not have any beta 2 action, but it will stimulate other receptors like alpha 1, alpha 2, and beta 1. The next drug I would highlight is dopamine. The action of dopamine on sympathetic system is complex and it is dose dependent. It means at the low dose, it will act on D1. At moderate dose, its action is mainly seen on beta 1, and at high dose, the action is predominantly on alpha 1. So hence, at low dose, you would see the major action on the mesenteric and renal blood vessels, vasodilatation. Moderate dose, you would see action on the heart, increase in force of contraction, and whereas alpha 1 action, you would see that it would cause vasoconstriction and increase blood pressure. A similar dosage action you can also see with epinephrine, because epinephrine at low dose have more action on the beta 2 as compared to alpha 1. But at a higher dose, moderate to higher dose, its more action is seen on alpha 1 receptors. Another drug which you should know is dobutamine. Dobutamine is beta 1 selective and it stimulates beta 1 receptor, thereby it increases force of contraction. So this is heart specific drug. Metaproterenol, that's another drug which is beta selective. It means it can stimulate both beta 1 as well as beta 2 receptor. Metaproterenol, isoprenaline, so those are the drugs. Phenylephrine. Phenylephrine is selective to alpha receptor, so it's an alpha agonist. It stimulates both alpha 1 as well as alpha 2 receptors. Whereas albuterol, terbutaline, formoterol, salmeterol, these are all beta 2 agonist, means it selectively stimulates beta 2. And thereby it causes bronchodilation. So it is specific for bronchial smooth muscles and hence it is used in bronchial asthma. Now heading on to adrenergic antagonist. Adrenergic antagonists are broadly classified as alpha blockers and beta blockers. Alpha blockers are the drug which blocks alpha 1 or alpha 2 receptor. Now in that, the non-selective alpha blockers includes non-competitive antagonist, which is phenoxybenzamine. Now, why phenoxybenzamine stands out in alpha blocker is it is non-selective and it is irreversible. Whereas phentolamine is non-selective alpha blocker, which is reversible or it is competitive. Whereas we have also got selective alpha 1 blockers, which includes, or this drug ends with usually with zosyn, like prazosin, doxazosine, tamsulosin. And you also have selective alpha 2 blocker, which is there's only one drug, that is yohimbine. Now on the other side, we also have beta blockers. Now beta blockers are the drugs which selectively block beta receptors. Now in that we have non-selective beta blockers, which blocks both beta 1 as well as beta 2 receptor. So examples includes propranolol, timolol, whereas selective beta 1 blockers, which blocks only beta 1. And the examples include metoprolol, esmolol, atenolol. And there are beta blockers with additional alpha blocking, means they block both beta as well as alpha receptors, and they are much powerful vasodilators, which includes labetalol, carvedilol. So these are the drugs affecting the sympathetic receptors. Now we are moving to the last group of drug which inhibits reuptake of norepinephrine. Now listen carefully. Here the reuptake is done by a special transporter. For example, the norepinephrine reuptake is caused by norepinephrine transporter. Serotonin reuptake is caused by serotonin transporters. Now there are drugs which can inhibit the reuptake of the neurotransmitters. So classical example would be cocaine. Now cocaine is a drug which can inhibit the reuptake of dopamine and norepinephrine. Whereas other examples you would see is tricyclic antidepressants and SNRI, which can inhibit the reuptake of serotonin and norepinephrine. These are predominantly used as antidepressants. And there's another drug which inhibits reuptake of serotonin, which is called as SSRI, that is selective serotonin reuptake inhibitors. In my another lecture, I have already explained about synthesis and metabolism of the uh, catecholamines like dopamine, norepinephrine, and epinephrine. And I also discussed about MAO inhibitors, which is specifically MAO A inhibitors and MAO B inhibitors, and as well as I've discussed COMT inhibitors. So thank you very much. This finishes the session on adrenergic neurotransmissions and drug affecting it. Thanks for watching. Goodbye.